was in the basement. The rooms were small and they tended to be very musty. And so clinically we were very jammed. We also shared it with medical oncology, so they were in the same space, as was the pharmacy. And so all of us were jammed into a tiny little area where we sort of were careful when we turned around so we didn't bump into somebody. On the other hand, we did get a lot of informal consultations very quickly with each other, sometimes whether we wanted them or not. So it was tight. One of the questions that we always ask is when we go into a newer place, are we going to in fact improve cure rates, or are we going to simply look better? It turns out that it isn't the knife, it's the guy or the girl on the handle that's important. And for our specialty, it is the person who is understanding the disease and doing the procedure, not exactly how much chrome is on the door and glass. We call the chrome and glass factor. Still, it is nice for the patient's sake, if for nobody else, to have a much nicer facility. It's one of the wonderful things we're looking forward to in the new building. But certainly it's the people that provide the care. Glass and chrome rarely by itself will cure cancer. I have been over to the new hospital a number of times now, and it's gorgeous. It truly is nice in many ways. One of the most exciting things is all the cancer services are packed into one place, so that this issue of being able to quickly get a consult and opinion from somebody will be operative once again, although at this time we'll have to walk down the hall and just turn around and bump into somebody. Okay? We're very enthusiastic about it. I think that cancer patients need to be treated with dignity, and they need to feel that they're important to the system. Looking at the lobby, I'm thinking how I would feel as a cancer patient, and I would feel that somebody cared about me and my disease simply walking in there. So the building really gives that impression. Now in the end, buildings also, as I said before, rarely cure cancer by themselves. It's almost always the physician or the nurse or the therapist or the person giving the chemotherapy or the pharmacist that does it, rarely the building. So in the end, it's up to us still. But I'm looking forward to that first impression being a good one. At first approximation, the building will not change cancer care, and it shouldn't, except perhaps to elevate the whole mood and the whole atmosphere. In time, though, I think the ability to be so close to all of our other colleagues, instead of spread out the way we are now, is going to lead to more informal consultations. Cancer patients are going to feel more cared about. It shouldn't be. It shouldn't matter whether they walked into a beautiful place or an ugly place. But the fact is, we're all human beings, and when you walk into a place where it is clear that people care about the place, the feeling that people get is that they care about the patients.